mental health awareness has obviously gone through the roof. And that's a really good thing for a lot of people. So, people who traditionally wouldn't talk about having mental issues because of the stigma are now starting to talk about it. But like any intervention, there are unintended consequences that are not helpful. And what I mean by that is that there is now emerging research showing that the more you talk about mental health, the more you talk about emotions and you ask people about their emotions, they then start to identify more with negative emotions. And then they start to go, oh shit, yeah, maybe I do have an issue. So I find that it's really good for the people who have significant mental health issues, but it's also tipping over people who just have difficulties in life, like fucking Homo sapiens have had for 2 million years. Life is not easy. And the problem is that we're now pathologizing normal emotion. That, if somebody has somebody in their family that dies, it is normal to grieve for months, right? But now we're going, oh, well, that's not a normal condition. Here's an antidepressant. Or people who, are feeling low mood because they're under pressure or they've just lost a job or a relationship breakup. Now it's a condition that can be managed with medication. And so these are the unintended consequences. It even spills over into schools. I mean, I could talk all day about the impact on schools. And for me, we need to build our capacity to deal with stressful environments, not just be going, hey, you've got an issue, here's a label, here's a treatment. That can be pretty bad for quite a lot of people. But I do want to make the distinction between people with serious pathology, whether it's depression or anxiety or OCD or any of those things, whereas people who are way at the other end of the continuum, where it's just negative emotions now being pathologized and labeled.
100%. And I think it's like everything in life. You look at the political landscape, you look in general at the polarity in the world, and it's almost what's happened in this area where it wasn't talked about. Now it's talked about so much that it's become, people don't accept that life's meant to be hard, like you're talking about, and saying,
exactly.
I'm going to have a mental health day because I woke up on the wrong side of the bed. And it's tricky because at the same time, we need to be sensitive to the fact that, like you were talking about before, there are real mental health issues going on. But because it's not a tangible thing, how do you decipher between what is and what isn't? People can use it as a scapegoat. You see it in the media even. I've seen it with many, I'm sure you've seen many examples where people might have done something wrong and blame it on mental health. And It's so tricky. It's so tricky. Yeah.
Because you can't say anything then, because it's like, oh, you're being mean and nasty and stuff like that. And
yeah,
we mentioned about schools earlier on. It's like the issue now. There are lots of parents who are in both your country where you're living now, actually, and over here, and in the UK, where parents are pushing doctors and psychologists to get a diagnosis for their kids, because they get extra time on exams, they get like free rides on certain things, and there's a lot of these pushy parents who are trying to bulldoze a path for their kids to make, and what they're doing is they're screwing up their kids' futures. They are destroying their kids' resilience. One of the big things, I've talked to numerous psychologists about this, your kids can do and have to do hard stuff. Your job as a parent is not to forge an easy path for your children, because once they flee the nest and interact with the real world, they're going to come crashing down big time. And this is what we're seeing with a lot of young people getting out of university and going into the real world, where there's not a friggin' trigger warning on a debrief from your boss, whereas at university there's trigger warnings everywhere. And you think of what happens, particularly if somebody's brain is is slightly anxious or being exposed to stress or is not dealing well with things, and then you go trigger warning, what happens is their amygdala fires up and goes, oh, this is dangerous, this is bad, we need to avoid this. And they're given an out to avoid it. And all they're doing is eroding their capacity. You know, the number one treatment for anxiety is exposure therapy. It's not avoidance. And what we're doing, again, and I want to stress, well-intentioned interventions that are really helpful for some people, but now not helpful for a lot of people. And even now the research is showing that avoidance and trigger warnings for PTSD are not helpful for these people because they set up that pattern of avoidance. So, you know, this is it's running very, very deep. But nobody talks about these unintended consequences, because if you talk about them, you know, you get all sorts of shit. I mean, I was on a podcast last week and I was talking about ADHD. One of the biggest predictors of a kid getting diagnosed with ADHD, do you know what it is? Next to their parents having had ADHD, so that genetic, do you know what the next biggest factor is?
No.
Date of birth.
Right.
So kids that are born late in the year, the latest 25%, have on average a 38% increased chance of being diagnosed with ADHD than kids who are born late in the year, the latest 25%. It's just because little Johnny is young. He doesn't have ADHD. He's just young. He's immature compared to his peers, and his focus and his attention skills are not developed. Give him 6 or 8 months, he'll be right up there. But no, what happens now is teachers go, little Johnny's disruptive, I think he might have ADHD, goes and does an assessment. And these assessments, I think a lot of them are problematic. A lot of them have leading questions, particularly for young people. And a lot of them can be tweaked as well. You know, this is my biggest problem with mental health diagnosis, is there's not one mental health diagnosis that has a consistent biological signature, right? So what I mean by that, I know I've got diabetes or don't have diabetes because of my blood sugar. I know I have high blood pressure or don't have high blood pressure because of the biological signature. You know you have cancer because of the biological signature. Every single health condition, physical health condition, has a biological signature which they can go, bang, this is what you have. Mental health, it's all based on questionnaires.
Yeah, so is ADHD actually a thing, do you think? Like, it's something that people do have, but now we're just sort of blanketing it?
Absolutely. ADHD is a thing. Depression is a thing. Anxiety is a thing. But all of these, there's a continuum.
Spectrum, yeah.
There's a spectrum. And like Bill Gates has said that when he was a kid, if he had to get tested for ADHD, he would probably be diagnosed with ADHD. I would quite possibly be diagnosed with ADHD, right? Because stuff that I don't find interesting, I'm fucking shithouse. She asked my wife, I'm shithouse at focus on it. But if I'm interested, man, I get hyper-focused, right?
Same.
And Elon Musk has said the same thing, right? There are people who are now saying there's actually an ADHD phenotype, right? There is a phenotype of a collection of genes that lend to that actually has some advantages for creativity and all of those sorts of things. So now people who have severe ADHD, right? Like medication for them can be life-changing. But kids who actually have just inattentive issues, either because they're young or a combination of their diet shit, right? They don't do physical activity and they have screens in their bedroom and they're not sleeping well, right? I interviewed Professor Martin Ames. He showed 5 days of sleep deprivation, your brain looks like an ADHD brain. So
Absolutely.
I think a lot of this is actually lifestyle driven, particularly the milder stuff. And I do want to make it very, very clear, I'm not talking about people with severe ADHD, who actually the medication for those people can be game changing. But people who are down that low end of the spectrum, where actually a lot of it's lifestyle or it's very, very mild, and then these kids are on Ritalin, they're on friggin' speed, right? that completely changes the brain. Like
Mm,
any
mm.
psychoactive drug, any of those interventions, they all have huge amounts of side effects, particularly long term. You cannot take anything that is changing neurotransmitters in your brain and not have a significant amount of side effects, particularly in the long term.
Especially while your brain's developing, like you're saying, like, yeah,
Especially while your brain is developing. That is absolutely right. And the worst of these, we're talking a lot about ADHD. The worst of it is depression. Um, the Maudsley deprescribing guidelines. So these are the first ever guidelines that are giving doctors guidelines, psychologists guidelines for getting people off antidepressants. They have estimated, and I interviewed Mark Horowitz, who's a psychiatrist, him and I can't remember the other co-author. They estimate that only 15% of people who are on an antidepressant currently have a valid reason for being on those antidepressants. 15%. That's mental. And
terrifying.
a lot of people think that these drugs are safe and don't have many side effects. Nothing could be further from the truth. I would encourage, and I will send you the link so that you can share with it. There has been a number of studies that have been done surveying real people who have been on antidepressant medications. Looking at, again, I've interviewed some of these people, looking at the side effects, right? And more than 50% of people report having around 10 side effects, serious side effects, from sexual dysfunction, not feeling like myself, having everything being gray, suicidal ideation, especially when they try to get off them. More than 50% of people who are on antidepressant medications have suicidal thoughts when they try to get off them. Right? And the
Unbelievable.
effectiveness of these drugs, they're way less effective than any exercise intervention. Right? They have an effect size. All right, their effect size is actually really small. It's just like slightly better than placebo, with a ridiculous amount of side effects. And I am certainly not critical of anybody who's on these drugs, but were they told by their doctor the amount of side effects and the effectiveness of those drugs? And only between 1% and 5% of people in these studies are ever told about the side effects.
100%. And there's just not enough regulation around how people are diagnosed, how they're put on different medications. And as you're talking about there, we don't have the education, we don't have the resource in the world to explore all of the other options before going down that path. Like you're saying, a lot of studies show exercise being as effective, if not more, than
Oh, it's
antidepressants.
more effective every time. More
More
effective.
effective. I think an exercise, I mean, we all know how beneficial it is. How many of us, with my company, that's really, what we're using as the forefront tool to try and help people to change their lifestyle, just get moving, exercise, because it will have a follow-on effect to every other part of your life. And, you're talking about anxiety before. I suffered from, that's the biggest thing I've suffered from. I had severe anxiety, depression in my 20s. And I saw so many therapists. I was put on medications and went off them because I didn't like it. Was told to do all these different things. Nothing worked. The only one thing that did work was immersion therapy. I was
Mm.
afraid of my own shadow. I was in university. I had to go and speak in front of, it was like 5, 10 people, and I was terrified. Didn't want to do it, but had to do it. That got me out of my head. Then I ended up having a career speaking in front of crowds of people, and
There you
that
go.
and I learnt the lesson in that. I was like, okay, like, hang on, my brain's telling me before I speak in front of these 5 people when I was terrified that I'm going to fuck it up. No one wants to hear what I have to say. This is going to be the end of the world. And I actually did a pretty bad job doing it, and it was still fine. And, doing that enough, I thought, oh, this is great. I feel like a different person. I applied that to everything else. That has been the only thing that's really helped with the anxiety. You sit, worry about a problem, that's just going to compound. Go and take action, and you reduce it dramatically. So it's just, we're not
Mm.
taught how to do this. And this isn't to blame anyone for being in this position. This is a fault of society, how we're structured. We don't have the infrastructure to accommodate to
Yeah.
all of the people that have these, you know, that need this help.
And here's the thing. 85% of psychiatric medication is administered by non-psychiatric doctors.
It's crazy.
Right? Who don't have training in this, who think they read the back of the label and that's about the drug company. So how this goes back. So Professor John Reed has done a lot of work in this area, right? And he said, you know, when they do the clinical trials to get the drug approved, they design the study and they design the side effects list. Right. And so they'll ask about a number of different things, and they only ask for, you know, they do a very short term study. But guess what happens? If you don't ask about suicidal thoughts, if you don't ask about sexual dysfunction, if you don't ask about not feeling like myself, they don't exist. Those side effects don't exist if you don't ask about them. Do you know what I mean? And then the doctor is then getting this pamphlet and going, well, there's no real issues with this. These things are fine. And I bet you my bottom dollar that you weren't told when you went, or you probably went on an SSRI for your anxiety and depression. And I bet you a doctor didn't sit you down and go, this is just marginally more effective than placebo. Exercise would be a more effective intervention. So would diet on its own. Even creatine and vitamin D supplementation is effective as these things. And by the way, here's a massive list of the side effects. You got a 50% chance of having suicidal ideation, a 50% chance of having sexual dysfunction, blah, 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 blah. I bet you didn't get that discussion from your doctor.